Good afternoon, everybody. Here with Superintendent Dr. Leslie Torres Rodriguez, Police Chief Thody, Fire Chief Barco. The first thing I want to say is that there is a child, a 13-year-old boy, who is in grave condition in the hospital now, and our prayers are with him and with his loved ones and his friends and his entire school community. As I think you know, mid-morning this morning, there were initial reports of a student who was unconscious and breathing. Hartford Fire Department personnel arrived quickly on the scene and began to take life-saving measures. The initial information suggested that there may have been 3 students who had ingested a substance believed to be a drug, suspected to be fentanyl. Those 3 students were transported to the hospital, 2 for observation, but as I said, one of those children was and remains in grave condition. We have since gotten reports of initial analysis showing that the substance was fentanyl. We do not know for certain whether the other students ingested the fentanyl. There is an ongoing investigation. It appears that the drug was brought to the school by a student. Immediately after the first responders responded and the children were transported to the hospital, the school was placed in a code yellow, which is a situation in which everyone is asked to stay in place. And our police and fire, working with a number of other partners, worked to try to identify whether there was, were there any other drugs or any other traces of this drug present around the school. There were multiple additional bags of what we believe was fentanyl found around the school, which again we believe was brought by a student. I want to thank all of our first responders, all of the many partners who have been here throughout the day, all of our school staff, our teachers, our principal, our superintendent and her entire team, and everyone who has worked to try to respond responsibly, to keep our kids safe, and to support the kids in this school during what was a very difficult and traumatic day. Again, investigation is ongoing, so there may be information that we cannot share now. And I want to reiterate that all of our hearts and prayers are with the child who remains hospitalized in grave condition and with his loved ones. I also want to stress that this is one more lesson that fentanyl is a poison. These drugs are a poison. And please, if you're a parent, have that tough conversation with your child tonight. That if anybody offers, suggests that they experiment with or ingest some substance that they think is a drug or they don't know what it is, don't do it. Stay a mile away. And for God's sake, please report it so that we can try to protect your child, their friends, and every kid. May have a few other words to say later, but again, I want to say thank you to all of those who responded and to the medical professionals as well. Superintendent, I'll turn it over to you. Thank you very much.
Thank you, Mayor Bronin, and I do want to extend my heart to the 7th grader and his entire family and the other 2 students as well that were involved, and to the entire school community at Sports Medical Sciences Academy. This has been and continues to be a really hard day for all of us. Also extending gratitude to the partners for their coordinated efforts and response in trying to keep each and every one of our students and staff safe. We know that this is a hard time. There are still many unanswered questions, and so to our students, staff, families, and community, we will continue to communicate as much as we can and when we have the information. Our crisis team has been deployed. It was deployed earlier, and we will continue to make those services available to our students. This is a very serious matter. As the mayor said, a number of partners and experts are here, not only local, but at the state level as well. And so I just wanted to pause and reiterate what the mayor stated with regard to our families, our caregivers, having conversations as to the seriousness of any drug, especially unknown drugs, and that if a student, family, or anyone sees something, to say something, because not only do we have folks at school that can support, but we have experts that can help us try to get to the bottom of what has happened. Again, my heart goes out to not only the 3 students and their families, but the entire community at Sports and Medical Sciences Academy and at Hartford Public Schools. We know that before this incident happened, there was such hard times as we continue to manage through the pandemic. And we are quite aware of what this added layer of worry, stress, anxiety might bring for all of us in our community. And so again, to our partners, thank you. And it is still evolving in terms of the investigation. And so as we have more information to communicate with our families, we will continue to do so.
Thank you, Superintendent. We're happy to take any questions, including our police chief and fire chief and some of our partners. That's
12 to 13 years old.
the child who is in grave condition is 13.
Seventh graders.
All seventh graders.
Have the other 2 children and teacher been released from the hospital? The ones that may have been exposed?
At this point, we don't have that information.
Have you been able to talk to anyone involved as far as the teacher or the 2 students, other students?
The critical piece here was to get here, render aid, and make sure and limit the exposure. That's where we're at now. We have investigators that are assigned to the follow-up investigation. We don't have anything to release about that investigation at this time, but it is ongoing.
The reason I ask, I'm wondering if you know at this point whether the student who ingested it realized what he was doing or thought maybe it was candy or some other substance.
We wouldn't have any indication of that at this point. Hopefully the investigation will lead us to the answers that we're looking for, but we don't have any indication of that right now.
And the drugs that were found throughout the house or out the school, were they hidden or were they in plain sight?
No, we found them in a subsequent search. We found additional packaging in 2 classrooms and the gym, and that's what led us to where we are now.
Is it believed that these different packets of substance, was it brought in at this point, believed to be brought in by the same student? And do you think that it was brought in to be sold within the parameters of the school?
We don't have any way of knowing that until we get further in the investigation and have conversations with some of the students as well as others involved. So hopefully we'll be able to get to that, but that's all part of the ongoing investigation at this time.
But I think we can say, Chief, Chief, correct me if I'm wrong, but I think we can say that the tentative belief is that what was found today was all from the same source.
And how many bags total found?
We had multiple bags in multiple rooms. I don't have an exact count yet. The search is still ongoing. The goal here was to evacuate the school safely, and then that'll leave us to be able to search the school thoroughly.
And just to have this information correct, just so that we've got this, that the teacher who was brought to the hospital, was she the one that was in the gym class with the students that ran over? I know that earlier we had said that immediately a teacher intervened. Is that teacher the one that's in the hospital?
I believe we had clarification no teacher was transported to the hospital. The superintendent may be able to clarify, but we don't know of a teacher transported now.
The teacher was highly upset about what she had witnessed, and so we had to support the teacher.
Okay, so no teacher went to Hartford Hospital today.
At this point, we had to provide support to the teacher on the ground, on the school ground, on the premise.
And was she the one that immediately intervened upon seeing what was happening in gym class?
In the gym class where the student, yes, collapsed.
All three of them were.
One student was in the gym at that point,
Where
Of the
were
three.
the other two?
in another location.
So were they together in another location, or were they also spread out in other rooms?
What we know is that they were together in a classroom initially.
So does that mean that one of the other packets of drugs could have been the source of exposure? One of the other packets of drugs could have been the source of exposure for the other two students that weren't here.
We don't, again, this investigation is ongoing, so the specifics are going to have to be something that we find out through talking to the students. We want to make sure that they're healthy first. That's the most important thing. So we'll find out more as the investigation progresses. We know we have multiple packets that were found in multiple rooms, and we have at least 3 students that we believe were exposed. That's the extent of what we know at this point.
And one that ingested.
One that ingested it, that's the one that's in grave condition right now in the hospital.
I'm not sure what form the drugs were in, because oftentimes, unfortunately, fentanyl is supplied with, or other drugs are covered with fentanyl, cocaine, or marijuana, all kinds of different drugs. What form was it?
That will all be found when it's tested. It was presumptively tested for fentanyl. Our DEA partners are here, and they have offered up their laboratory services, and we'll be getting that drug more thoroughly tested, and we hope to have results as soon as tomorrow on that.
Was it powder or a solid substance? The package?
We're not going to talk about that yet.
Okay, and as far as like reaction to this kind of thing, even just exposure levels, could that be dangerous as well for people at home that are watching this and they're saying, you know, what's the impact of just being around something versus actually ingesting something? Can you have a reaction just by
I'm going to give a quick reaction and then invite anybody else to add on to it. Fentanyl is a poison, and it is a powerful poison, and you don't need to ingest it for it to poison you. Just being around it, breathing the air in a room where it's in, can be dangerous. We've had incidents where our own law enforcement officers have been exposed by being in a room where there was fentanyl and subsequently had to be rendered medical aid. This is powerful, it is poisonous, and coming into contact with it can be deadly.
I have a question. If that's the case, can you just talk about, I guess, decision making of what the school day looked like inside the school? Because kids are just getting let out of school now. So, I mean, was there a lockdown? What was done to kind of keep them safe?
Yeah, so as the mayor referenced earlier, there was a code yellow, and so that means that everyone stays where they were at the moment of notification to the school, to the main office, and they were not movement. There was no movement for a few hours, right? Students did not move, and so we continued to communicate with our classrooms. We were not able to distribute lunch to our students because, you know, after the guidance from our experts, we could not risk contaminating any other area. And so this is why, as part of the dismissal process, an area was established for each and every student and staff member that was in the school to step into and decontaminate their shoes.
We see DEP here.
Yes, they're here.
Considered a hazmat situation. If you explain what they're doing.
Yeah, so there's different variations of fentanyl. There's carfentanil and fentanyl. Carfentanil can be dangerous in the air. Before we get conclusive tests, we had to treat this as a worst case scenario, which is why the lockdown, which is why the DEP is here. We had to lock the school down and make sure that we did not increase exposure. So as superintendent said, the clandestine lab team from the Drug Enforcement Agency was here to help us. We have members assigned to that team to help decontaminate. So the students and teachers and anybody that was in the school had to walk through a solution of bleach and OxyClean, which dissolves and neutralizes the fentanyl before they were allowed to leave the building. And then we'll have to make sure that the building is clear. That could involve some level of decontamination as well. That decision will be made with the health department and others before anybody can return in there. But it does turn into what could be considered a hazmat situation at that point, so that we don't have additional exposures.
So it kind of sounds like there's a lot happening left today. Still.
Absolutely.
Yeah.
When the students were leaving the building, or were their backpacks and clothing, were they checked before they left? Make sure there weren't any other.
No, our concern was in decontamination. We didn't do searches. No.
Can I just add something? And again, Chief, please correct me if I get this wrong. I just want to stress, though, that one of the things that was done by the police, but also by multiple partners, was a thorough search of the school building, and of course, any materials that were inside the school building.
We also ran dogs through the school. So we had 2 Hartford police trained, drug trained dogs, and 1 from the Connecticut State Police that came here, and an additional HSI dog that came. So we had 4 dogs running through the school as well.
Are nurses' offices in Hartford schools equipped with naloxone or Narcan for these types of situations? And it's like you hope it would never even come to this point, right? But if not, is that something that maybe you'd be considering for the future?
So as with every incident, any crisis incident, we will have debriefs, not only internally, but of course with our partners. And so in collaboration, we will determine what else, right, we would need to consider.
So right now, you may have a stockpile of Narcan on hand within schools?
No, however, this is something that we have to consider moving forward. And again, at the direction of our partners, for us to determine to what extent, the level of training and support that is necessary.
Were the other 2 students who were exposed, potentially exposed boys also?
Correct.
And will there be school tomorrow?
So at this point, I have not determined whether or not we will have school tomorrow. I will communicate with our families this evening as to what the next steps are, and of course to give them an update as to the situation.
Now, is it safe to say, is it fair to say that these other 2 students that were in another room were possibly exposed?
It's safe to say they were possibly exposed. We can't give you any conclusive information about whether they intentionally ingested it, whether they did ingest it, whether they were simply near it. We don't know.
They were in a room that had.
Yes.
Yes.
But not the gym.
Different from.
That was after they traveled away from the room.
Oh, so they were originally in a classroom and then went to the gym, and that's where they were found. Correct. Got it.
That's where they were exposed.
No.
No, in the classroom, right? So there was, it is believed that the student ingested something in the classroom and then went to the gym.
What packet was found?
Packets found in the gym? Whether a packet was found in the gym.
Yes, at least 2 classrooms and the gymnasium is where we found that.
And the teacher who was the gym teacher?
The teacher was supervising in the gym, yes.
Were the classrooms where the bags were found evacuated when they were found?
No, so the protocol was to hold everybody in one place and secure those rooms, but where the packets were found, each of those kids, those were the first 2 rooms that we dealt with. Each of those kids were evaluated by EMS, and they were the first ones to be decontaminated and the first ones let out of the school. Those, most of those kids left with parents. So that was step 1, and then we had a larger evacuation of the school that you just saw.
Did they have to go through the same decontamination that you described?
Yes, in addition to that, they also went through a medical evaluation.
So what will be happening for the rest of the night in terms of the investigation?
So from our perspective, now that the school is clear, the Drug Enforcement Agency, the State Police, the DEP, our detectives will be going through the school to do a search, a secondary, more thorough search to make sure that we get all the material that's in there. That'll include all of the equipment, canines, everything that we can use to do that. And then from there, it'll be kind of looked at by the health department and the DEP as far as any kind of decontamination that might be necessary, especially in those specific areas that we found the product.
Okay, I'm sorry I keep driving this home. So there was were the three of them together in the classroom? One was ingested it, went to the gym, and the other two were still in the classroom.
I don't think
I just want to make sure we have this right.
Yeah. I don't think it's clear like where it was ingested, and it seems as though that they were together when it was ingested, and then separated, and then once it was discovered, that's how we found the kids that were involved. But again, this is all part of the question and answer to make sure we get the exact information. Unfortunately, the one student is not able to talk to us at this point. So I think more of that will come out as the investigation progresses.
Folks, I know there's lots of questions. I think we've shared all the information that we have, and we will share additional information as we get it. As we close out, let me just again say that our entire community is praying for this child in the hospital and for his family. And again, make an ask of every parent to talk with your kids and make sure they know how serious and how dangerous any unknown substance can be and any drug can be. Please have that conversation tonight. We're talking about 7th graders. It's never too early to have that conversation, to ask your kids to be careful, to stay away, and as the superintendent said, to say something so that we can avoid situations like this, which can be a matter of life and death. Thank you all very much. Again, investigation remains ongoing, and we will share information as we get it and as we can. Thanks, everybody.